Hi everyone, my name is Lindsay Roberg and I'm excited to present an organizational development proposal for Friends of Caroline, where I serve as the president and CEO. This presentation outlines an internal intervention focused on strengthening communication and collaboration during a time of rapid growth. Friends of Caroline is experiencing rapid growth, particularly with the expansion of our inpatient services. This growth has revealed gaps in internal communication, collaboration, and workflow efficiencies. The organizational development intervention is designed to strengthen team dynamics, improve structured communication, and align internal operations more closely with our mission of delivering compassionate hospice, palliative, and grief support services. Our approach emphasizes a human process intervention focused on building psychological safety, trust, and operational clarity, ensuring Friends of Caroline continues to deliver exceptional services while adapting to operational demands. Friends of Caroline is a nonprofit organization dedicated to providing palliative, hospice, and grief support to individuals and families in our community. Established over 45 years ago, we're rooted in a mission of compassion, dignity, and excellence in care. Recent expansions, including the opening of a new inpatient facility, have resulted in increased patient volume, operational complexity, and new staffing challenges. These challenges have highlighted the need for improved internal communication, better cross-functional collaboration, and stronger alignment between departments to maintain our high standards of care and fulfill our mission effectively. We've selected a human process intervention with a focus on improving team building and communication. This approach directly targets interpersonal dynamics and system-level communication structures. The ultimate objective is to reduce silos, ensure trust, and support more effective cross-functional collaboration. In this intervention, I serve a dual role as both the internal consultant and executive leader. This provides a unique advantage. I understand our strategic direction and internal culture deeply. However, it requires me to uphold neutrality and rely on evidence-based tools to maintain objectivity. Given the sensitivity of change efforts, we're guided by APA ethics to ensure confidentiality, voluntary participation, and transparency. These principles are critical in gaining staff trust and creating a psychological safe environment where authentic feedback can be shared. We're using the open systems model to understand how different parts of the organization interact. To diagnose the root causes of communication breakdowns, we'll apply a mixed method approach: surveys, interviews, observations, and document reviews, capturing both quantitative and qualitative data. The tools include the Team Steps Teamwork Perceptions Questionnaire, focus groups, and one-on-one interviews with staffs across different roles. Observations and document reviews, like meeting minutes and patient care records, will give us additional context about workflow and bottlenecks. Based on diagnosis, we'll implement a series of interventions including team building workshops, communication training sessions, and structured feedback loops. Leadership coaching will support managers in modeling healthy communication behaviors. All components are grounded in OD and healthcare communication research. Here's our timeline. Weeks 1 to 3 will focus on diagnosis and feedback. Weeks 4 to 5 will include training and team building. Weeks 6 through 10 will emphasize reinforcement and evaluation. This sequence follows Cummings and Worley's general model of planned change, ensuring a logical flow. Several contextual factors must be considered. Internally, we're navigating staffing constraints and ensuring leadership alignment. Externally, we're accountable to healthcare regulations and deeply committed to preserving the trust of our community. These all influence how we design and pace the interventions. We've planned for potential challenges. For low participation, we'll offer flexible scheduling and incentives. If a resistance arises, we'll engage early adopters and use feedback loops. Leadership turnover will be addressed through board updates, and if patient census spikes, we'll use digital learning formats. Evaluation will follow Kirkpatrick's 4 levels: reaction, learning, behavior, and results. This allows us to assess not only if people liked the training, but if they learned from it, applied it, and whether it led to better organizational outcomes like improved communication and coordination. We're also embedding continuous improvement into our plan. During the intervention, we'll conduct bi-weekly reviews and make real-time adjustments. Post-intervention, we'll do quarterly pulse surveys and ongoing focus groups, which will keep the momentum going. Leadership development programs will reinforce the skills and behaviors that we've introduced. In summary, this OD intervention will help Friends of Caroline build a culture of collaboration, communication, and psychological safety. By doing so, we're not only enhancing team performance, but also elevating the care we provide to patients and families. Thank you for your time, and I'm happy to answer any questions you may have.